Thank you for inviting me to come here and participate in the opening of New Jersey Healthcare Industry Week. My goal this morning is to help you understand the incredible healthcare resources that currently exist at UMD&J and to understand the exciting possibilities that will come to fruition with the integration of UMD&J into Rutgers and Rowan universities. Since I'm speaking here at Rutgers, I'll focus most of my remarks on the opportunities that will result from the UMD&J Rutgers integration. However, it's important to note that there are significant opportunities for advancement with the integration of the School of Osteopathic Medicine into Rowan University. Like Rutgers, Rowan will also have two medical schools after July 1st, 2013, namely the School of Osteopathic Medicine and Cooper Medical School, which is an allopathic school in Camden. Since I'm often asked to explain the difference between osteopathic medicine and allopathic medicine, I'll briefly digress and give you a quick overview. Osteopathic medicine offers all of the same treatments of allopathic medicine, allopathic being the traditional MD. That is, medications, surgery, and the use of technology in care. However, osteopathic physicians also frequently offer the addition of osteopathic manipulative therapy. This manipulation of the musculoskeletal system is used to aid in the treatment of a variety of problems. It is a hands-on technique used to treat pain, restore mobility, and influence the body's structure to help it function more efficiently. Students who graduate from osteopathic medical schools can train in residency programs that are sponsored by either osteopathic schools or allopathic schools, and they frequently do the same specialties as their allopathic colleagues. Moving on. As I mentioned earlier, most of the schools of UMD&J are in fact being integrated into Rutgers. I'm often distressed to see this integration described as the merger of the state's medical schools into Rutgers. I find this to be a bit distressing because UMD&J is so much more than its three medical schools. Clearly, two important components of UMD&J are New Jersey Medical School, based in Newark, and Robert Wood Johnson Medical School, based here in New Brunswick. Both are allopathic medical schools that engage in a significant amount of patient care through their faculty practices, as well as research, community service, and education. However, in addition to the medical schools, 5 other schools will become part of Rutgers. They are New Jersey Dental School, the Graduate School of Biomedical Sciences, the School of Health-Related Professions, the School of Nursing, and the School of Public Health. It should be noted that the medical schools are not even our biggest schools. While New Jersey Medical School has 745 students enrolled and Robert Wood has 600 students enrolled, the Graduate School has over 1,200 students, the Nursing School has nearly 1,400 students, and the School of Health-Related Professions has 1,600 students. When you think about the fact that in the 21st century, quality health care requires a great deal of teamwork, the health profession students trained at UMD&J will increasingly be provided with opportunities to learn as members of interprofessional teams. The availability of interprofessional training will be further enhanced by our integration with Rutgers. Nothing exemplifies more clearly the importance of a highly functioning interprofessional healthcare team than the story of Congresswoman Gabrielle Giffords. On January 8, 2011, Representative Giffords, along with 18 other people, was shot outside a grocery store in Casas Adobes, Arizona, which is just outside of Tucson. Because of the tremendous strides we've made in medicine and surgery, patients with previously fatal head injuries, spinal cord injuries, and stroke now not only live, but make what many consider to be miraculous recoveries. In this case, the neurosurgeons clearly did a phenomenal job in repairing the injuries to Representative Giffords' brain. And yet, it must be noted that those neurosurgeons were not alone in the OR as they raced to save her life. Key to her successful outcome was the anesthesiologist who put her to sleep and constantly monitored her during surgery. There were a number of OR nurses and technicians assisting as well. Prior to going into surgery, her brain was imaged, probably using a CT scan. There was a technician who operated the scanner and a radiologist who read the scan. She probably had several x-rays as well, and a different set of technicians with different set of skills performed the x-rays. Within our medical schools, we graduate students who go on to do residency training in neurosurgery, anesthesiology, and radiology, among others. In fact, New Jersey Medical School offers residency and fellowship training in 57 specialties, ranging from internal medicine, pediatrics, and OBGYN, to pulmonary critical care, trauma, and endovascular neuroradiology. We have similar programs of training at Robert Wood Johnson Medical School as well. Given her significant head trauma, Congresswoman Giffords would have been taken to one of 3 Level 1 trauma centers had she been injured here in New Jersey. These centers are at University Hospital in Newark, Robert Wood Johnson University Hospital here in New Brunswick, and Cooper University Hospital in Camden. Note that they are all part of vibrant academic health centers, and each serves as the principal teaching hospital for one of the 3 allopathic medical schools here in New Jersey. The UMD&J School of Health-Related Professions offers certificates and degrees in radiologic imaging modalities and medical imaging sciences. In other words, they train the people who take the x-rays, CT scans, MRIs, and nuclear medicine scans. The School of Health-Related Professions also trains a range of professionals focusing on clinical laboratory sciences. These are the people who receive the blood and tissue specimens from Congresswoman Giffords looking for signs of anemia, infection, or organ failure, both during her surgery and throughout her hospital stay. Much of her recovery was due to the outstanding nursing care she received while in the OR, in the intensive care unit, and on the surgical unit in the acute care hospital. She was undoubtedly cared for by professionals with a bachelor's degree in nursing, as well as by advanced practice nurses, some with doctorates in nursing, who are trained to assist in the provision of acute and critical care. Again, all training available from the UMD&J School of Nursing, a school that will soon be combined with the Rutgers College of Nursing based in Newark. The quality of nursing care was even more important during her stay in the rehabilitation hospital, which followed her discharge from the acute care hospital. Additionally, much of the miracle in her recovery was due to the tireless work of her occupational, physical, and speech therapists. The occupational therapists worked to make her independent in caring for herself. They retaught her to brush her teeth and comb her hair, get dressed, and used instruments of daily life, like a telephone. The physical therapists worked to strengthen her muscles so that she could walk again. And speech and language pathologists not only worked to help her speak again, they also evaluated her to make sure that it was safe for her to swallow food. And speaking of food, Gabrielle Giffords' recovery was greatly aided by the hospital dietary staff, who served her food prescribed by the hospital dietitian that ensured that she had the proper nutrition to help her heal. The School of Health-Related Professions offers programs in occupational therapy assistance, physical therapy, dietetics, and nutrition. While speech pathologists are not trained at UMD&J or Rutgers, there are programs at Stockton School of Health Sciences and Montclair State, to name a few here in New Jersey. Congresswoman Giffords was the recipient of high-quality health care provided by a well-functioning interprofessional team. The further development and refinement of interprofessional teams will be one of the most significant advances in healthcare moving into the future. It should be noted that teams are increasingly important in biomedical research as well. When we look to the synergies that will be created by the integration of the 7 schools of UMD&J into Rutgers, the opportunities to create even more centers of excellence and high-quality educational and clinical programs are enormous. For example, another member of Congresswoman Giffords' healthcare team were the pharmacists, who made sure that she got the right medicines in the right doses as prescribed by her physicians. They also helped to alert her physicians about potential drug side effects as well as adverse drug reactions. After the integration, the Ernest Mario School of Pharmacy will be part of Rutgers Biomedical and Health Sciences along with the 7 schools. This will lead to an even greater opportunity for collaboration in teaching, clinical care, and research. Furthermore, Rutgers has outstanding programs in psychology and sociology. Working with faculty from those disciplines, we might someday better understand the causes of gun violence, and ultimately, we might develop interventions to stop it. Faculty and students from the School of Public Health, the Blaustein School of Planning and Public Policy, the Center for State Health Policy, and the Institute for Health Policy and Aging Research might also play a role in shaping public policy and legislation aimed at reducing gun violence and improving access to health care. Again, these are the types of collaborations that will be facilitated through the integration of UMD&J into Rutgers. There are also incredible opportunities for collaboration with faculty from the Rutgers School of Engineering, particularly the Department of Biomedical Engineering. For example, today, Shannon Agner, a PhD student in the department, is working on the development of methods to better detect breast cancer using MRIs. Biomedical engineering has the potential to develop technologies that will more effectively detect and treat diseases. This is work that will be significantly enhanced by collaborations between the research faculty in engineering and medicine. And I just learned today that there's expertise here in the School of Labor around the development of interdisciplinary teams. And I look forward to working with colleagues from this school in furthering that set of skills as well. While the work of integrating these institutions is incredibly labor intensive, the potential outcomes of this integration are enormous. I believe we are truly on the precipice of creating an outstanding academic health center within a world-class comprehensive university here at Rutgers. And on that note, I will close and thank you.